Alright, so come in, wash your hands. I'm Megan. I'm going to be doing your physical assessment today. Can you state your name and your date of birth?
Justin Cosgrove, 52689.
Okay, perfect. Do you have any allergies?
Septra.
Do you have anything that concerns you today?
No.
Do you need to empty your bladder or
no.
You feel comfortable since we'll be here for a little bit to do this? Okay, perfect. So, first, look at the build. He's medium build. When he walked in here, his gait was steady. There was no limps, nothing abnormal. He was symmetric on both sides. His head is normal cephalic. His hair is evenly distributed. His eyelashes and eyebrows are also evenly distributed. I don't see any lesions. I'm going to touch and feel for any masses. Okay. Don't feel any masses. I'm going to touch his ears. Do you have any tenderness or pain?
No.
So touch his tragus and his pinnas. You don't have any pain. Can you bite real hard for me? Okay, can you judge your throat? Can you push your jaw out? Go. There you go. Bring it back. Move to side. Open. Close. Open and close again real quick. Okay. So, he didn't have any tenderness with his TMJ. He had full ROM of his TMJ. No pain anywhere on his face. I'm going to push on his frontal sinus and his maxillary sinus. Did you have any tenderness with either of those?
No.
He didn't have any tenderness with those either. Can you look straight ahead for me? As I look at his eyes, his sclera are white, his conjunctiva are pink. His eyelids are both the same. They come down to the same point, and one is not sagging. His nose and his mouth are both midline. His face is symmetrical. Everything. His ears hit, the top of his ears hit the outer canvas of his eye. I'm just going to shine this light into your eye, okay? And just look straight ahead for me. Okay. So his pupil is about 4 millimeters. They're circles. I'm going to look up, look down. Everything looks good there. Can you breathe in? Can you breathe in? Okay, so both of his nostrils, he's able to breathe in for him. Can you smile for me real big? Can you make a sad face? Okay, so that's testing cranial nerve 7. Whenever I can see, can you puff your cheeks out? Okay, perfect. So that one's intact. I'm going to have you look at the tip of this and follow it in. Okay, and then that was testing for accommodation. So his eyes are pearl, they're reactive to light and accommodation. I want you to look straight ahead for me, and I'm just going to move this here. Let's see. There we go. Okay, so I'm going to test this cardinal fields of vision. So you're going to follow this. Don't move your head, just move your eyes with it, okay? This one. And then I'm going to go lateral, and I'm going to see his eyes aren't jumping. And whenever I went laterally this way and held it, his eyes weren't jumping that way either. And then we already tested for accommodation. We are going to cover one eye for me, and then read the first 3 letters.
SUD.
And then cover the other eye, and then read the other letters for me.
Okay, you.
Okay, perfect. So he was able to read from 12 to 18 inches away from his face. Can you stand up, and then can you cover one eye about 20 feet away? There's an eye chart. Cover one eye and read.
EDF CZP.
And then we cover your other eye, and will you read the small sign that you can backwards?
PZCFDE.
Okay, so you can sit on down. So he has 20/20 vision. And whenever I was testing his cardinal's field of vision, you're testing cranial nerves 3, 4, and 6. What we're going to do now No, laptop. Okay, so can you open your mouth for me? Okay. Can you say ah? All right. So his tonsils aren't enlarged. Can you push your tongue up for me? Okay, and you move it side to side. Okay, can you lift it up for me? Okay. And his teeth look good. His hard palate is like a light pink, and his soft palate is a little darker. I don't see any lesions or masses in his mouth. His teeth, he has all his teeth. They're aligned, and it looks like he brushes his teeth. I don't see any big dental caries or anything like that. And then we also would test his gag reflex while we were doing that. So we tested your gag reflex. And whenever I had him say ah, I could see his tongue moving. And that is cranial nerve 10, I do believe. And then his uvula was also moving, which was something else I was looking at while he was doing that. Okay. So I'm going to look in your ears, okay? I'm going to pull your pinna up and back so I can look down in there. And his middle ear is pink. There's not large obstructions of wax or anything in there. His tympanic membrane is a pearly color. It's a pearly gray. There's no swelling or bulging whenever I look at it. Did you have any pain with any of that? Okay. Look straight ahead for me. I'm going to elicit the red reflex with his eye. If I can get this turned on. Look straight ahead for me. Okay. And then so he has the red reflex with both of his eyes. Let's see. Now I'm going to cranial nerve 1 is your nose. Okay, so can you cover up one nostril for me? And you're going to tell me what you smell. Okay?
Peppermint.
Close your eyes too. Okay, tell me what you smell. Okay, now you can change nostrils for me and include the other one. Okay, what do you smell?
Like lavender or something.
Okay, perfect. So he was able,
Pine trees.
He was able to tell the difference and correctly identify 2 smells. Can you push your shoulders up against me? So as I'm testing that resistance, I'm also testing cranial nerve 11. So we did 1 was nose, 2 were his eyes, 3, 4, 6 were his cardinal fields of vision. 5 was when 7 was whenever I had him smiling and all. 11 was doing that. 12 was his tongue movement, and then 9 and 10 was whenever I was seeing his uvula move. And then I'm going to test cranial nerve 8 by doing a whisper test in his ear. So can you occlude that ear for me? And then as I whisper, can you tell me what I whisper? 4. 6. Okay, so occlude. And 4. 10. Okay. And I'm also going to use this. I'm going to hit it on my palm, and I need you to tell me whenever you can't hit it. I'm going to sit on the top of your head. Okay? And can you hear it equally?
Yes.
Okay, you hear it equally. That's good. So that's testing his conductive hearing loss, or if he has any conductive hearing loss. So I'm going to hit it. Let me know when you can't hit it, and then I'm going to put it on your mastoid process. And this one I'm going to time.
No.
And so those were double. So his left ear was good. Let's test this ear now.
No.
It's done vibrating one time.
No.
Okay. So his right ear was a little less than double the time, whereas his left ear it was kind of right at double the time. So now I'm going to listen to his carotids and see if I hear any breweries. I'm going to listen with the bell for every time I'm listening for breweries. I'm listening with my bell. Okay. There aren't any, which is good. I'm going to feel for his carotid pulses. And so his left was strong, 2+. And then his right was also strong, so they were equal. And then now I'm going to feel for his cervical, all of his lymph nodes. I'm just going to do them all at once and go down even to his armpits. So I'm going to look for, turn your head for me, so you can see preauricular, postauricular, and then I'm going to feel in the back for occipital, tonsillar, submandibular. I'm feeling with the balls of my fingers, or the little pads of my fingers. Submental. And then I'm going to go back over to my superficial cervical chain. And then my post-cervical chain. And then my deep cervical chain. Sorry. And then I'm going to test for supraclavicular. Go over. And then I'm going to check for his lateral, his central, and his lateral. Sorry. Does that tickle? I'm sorry. And then I'm going to feel for his I'm going to untie this, sorry. His scapular. So if I haven't felt any, I'm going to go over to the side. Or subscapular, not super. Subscapular. Put your arm out for me. Okay. I gotta check his pectoral too. I forgot his pectoral. Sorry. Yeah, put your arm down. Okay. So none of those were felt. I'm going to check his range of motion for his neck now. So can you put your chin all the way down for me? Can you lean it all the way back? Can you go side to side? Can you turn your head? Turn your head side. Okay. Turn your head to the side. Okay, now do your ear down to your shoulder again. Okay. Ear down to your shoulder. So he has full range of motion. You're done. Full range of motion with his neck, and the strength of his neck is equal on both sides, and it's strong. So that was your head. Let me see anything on your head. Your neck. I assessed his shoulder strength whenever I assessed the 11th cranial nerve. Let's put your arms out now. And this might be easier if we stand up, actually. Oh, no, sit back down. I forgot to look at his nose. I gotta look at his nose real quick. And then we'll do your shoulders. His nose is clear on that side, no obstructions, clear on that side, no polyps. His oh goodness, turbulence or grade 1. Turbulence or grade 1. Pink pink mucosa within his nose, just like he had the moist oral mucosa within his mouth. Didn't look dry. There was no blood. No obstructions. Okay, so not stand up. I'm sorry. Okay, so we're gonna put your arms out, and then can you do a circle forward? Can you do a circle backwards? Okay, can you bring your arms up? Bring your arms down. Can you touch your toes? Okay, I'm going to touch your back too. I'm going to assess for a straight spine and a spine straight. And I'm also looking at range of motion. Now, bend back for me as far back as you can. Okay, can you go side to side? Okay, can you go to the other side? Okay, so his spine has full range of motion. So we can sit back down because I also forgot I'm going to palpate your thyroid. So I'm going to sit next to you. Okay, can you swallow? Okay, so I couldn't feel thyroid when he swallowed, and I also assessed his swallowing ability. Was that hard for you to swallow or anything? Okay, so he has good swallowing ability. We are done with this. So I'm going to move these over here. Oh, don't fall. So we assessed your eyes. I think we have everything with your neck now. Lymph nodes, thyroid. Okay. So now I'm going to have you sit straight up. I'm going to listen to his apical pulse, and I'm going to count it for 1 minute. Okay, his apical pulse was right at 60, but he's a runner and he works out, so it's normal to be on the low end. And I realized too, can you tell me where you're at?
My house.
And can you tell me the date?
It's like the 19th, I think. 27th.
So he's alert and oriented. His speech is coherent and clear. And if this house were to catch on fire, what would you do?
Leave.
Okay, so his abstract thinking's intact, and he knows to leave. Okay, I'm gonna listen to his the back of his lungs. I'm gonna percuss first, and then I'm gonna listen. And there's 10 places on his back. And I'm also, as I'm touching his skin every time, even whenever it was on the front, whenever I'm on the back, I'm looking at his skin to see, does he have any lesions? Is it warm? Are there spots maybe where there's not blood flowing? But his skin has been warm, dry, and intact everywhere I've looked so far. Take a deep breath. Let it out. Deep breath in. Deep breath in. Deep breath in. Deep breath in. Another deep breath. Some deep breath. So on his back, his posterior thorax, all of his lung sounds were clear. Hate that it keeps. Okay. And so, this is your spine, Rob. I'm going to listen to your friend. I'm going to listen to all of his lung fields here too. And this one, there's 8. Actually, I'm going to percuss first, and then 2, 3, 4, 5, 6, 7, 8. Okay. Now I'm going to listen. Deep breath. And as I'm listening, I'm comparing side to side. Okay, another deep breath. Okay, deep breath. Another one. Okay. Another one. Okay, 2 more. Go for me. And then 1 more. Okay, so all of his lung sounds were clear. And also up here. Now I'm going to listen to his aortic, pulmonic, his Erb's points, tricuspid, and mitral points. So, and in that order also. So I'm listening to your heart. You're okay. Okay, whenever I listen, I don't hear any murmurs or gallops, which is good. We don't want to hear any murmurs or gallops. I hear S1 and S2 audibly. They are not muffled by anything. I'm going to also take your blood pressure real quick. Slip this on your arm. Okay, so just keep your arm really relaxed for me. So he's about 124 over 72. And then I'm just going to okay, and his respiratory rate was 13. He isn't having a hard time breathing. And I'm going to have you take a deep breath in while I put both my hands on your back. Like that. Okay, there will equal expansion on my hands also. So he's clear and equal expansion, and no heaving, no resistance to his heart, no thrills. I'm going to have you lay down here for me, and I want you to lay on this side so that I can.
Go by listening.
Yeah. Okay, we can see. Okay, and I'm gonna palpate his PMI and see if I can feel any pulsations or heaves, thrills, anything. Okay, I don't feel anything. And then I'm gonna have you lay flat, and I'm gonna see if I can feel the. Actually, let's put your head down here so that I can, and put you, yeah. Cover your legs. I'm gonna look at your belly and your chest. Skin on his chest has normal hair distribution. It's normal color. It's within normal limit or normal color for his race. It's white. No masses or anything that I see on his belly. And then I'm on the right side. I'm gonna see if I can feel his sternal border, his liver. Okay, his lower lobe. I'm gonna listen to his belly sounds in all 4 quadrants. He has normal active vowel sounds in all 4 quadrants. And then now I'm going to do light palpation and see. I'm also doing all of this in a clockwise fashion. If you have any pain or rebound tenderness, let me know. Any pain with any of that? Okay. Now I'm going to do deep palpation. Let me know if you have any pain anywhere with this. Any pain with any of that? No, I didn't feel any masses, and then there was no rebound tenderness. I'm going to listen to his aortic, renal arteries, and then his femoral arteries for bruise, so I'm going to be using the bell again. Okay, so aortic, renal, okay? There were no bruise, which is good. You don't want bruise. Okay, so we're done with your, actually I'm going to do your femoral pulses when I'm right here too. Okay, the femoral pulses were 2 plus equal on both sides. Okay, let's sit back up. And then now we're going to go to the arms. I'm going to look for symmetry. His scapular is symmetrical. They are at the same spot on his back. His shoulders are even. I'm going to feel both arms. And they're warm, dry to the touch, skin's intact. I'm going to palpate for his brachial arteries. They're both 2 plus. I'm going to feel radial. They're also 2 pluses. So we're going to check range of motion before we do his deep pinion reflexes. And I forgot to do sharp and dull on your face. We'll have to do that. So that's the other cranial nerve. Okay, so let me see. Do circles with your wrists. Circles the other way. Up, down. Bunch your fingers. Go out with your fingers. I'm going to look real quick. His nails are not clubbed. Capillary refill is less than 3 seconds on both sides. He had full range of motion with his fingers and his wrists. Can you do like a bicep curl? Go out. Okay. And then can you Turn palms up. Turn palms up. Okay. So full range of motion with his elbow joints. And then we checked your shoulders earlier, didn't we?
Yep.
Yeah. So we did his shoulders earlier. Okay. So now, yep, limp like a noodle. And I'm going to try and get this. So there's that one. Probably a 2 plus. Limp like a noodle. Let me hold it. Yeah. Being silly. So silly. This is like my charger doll. Okay, so that one was like a 1 plus. I'm gonna check his wrist. I'm done with it. Those were both like 2 pluses for his hands. Do this one. Covered. So I'm going to do sharp and dull on his arms. Close your eyes for me. And then I need you to tell me if it is sharp or dull. Okay? Okay, and I just realized too, tell me which hand I'm moving, okay?
Right.
Tell me which hand I'm moving.
Left.
Okay. So, that was also testing his field of vision to be able to see things. Arms. We did choreography with your arms. We did range of motion with your arms. And now I'm going to look at his legs. As I feel them and I look at them, here's evenly distributed, no masses, lumps. And also whenever I felt his joint, there was no crepitus in any of his joints. And I'm going to do the same for his knees and his feet. His pedal pulses are 2 plus. You know, scoot to the edge of the bed. See if I can feel it. I might have to have your leg in your stomach. Like your, yeah. Tibial pulses are 2 plus. I'm going to check. That was like a 1 plus for deep tendon reflex. That was like a 1 plus. So his pedal pulses though were 2 plus, his tibials were 2 plus. Can we lay on your stomach real quick? And then I'm gonna check. And that was like a 1 or a 2. I mean, 2 plus deep tendon reflex. That was like a 2 plus. I'm just gonna feel it again, just to be sure. Okay, you're good. Okay, just roll over on your back though. And then scoot back for me, yeah. And we're gonna check his hip range of motion. So lift this leg out to the side for me. Okay, lift it up. Okay, do the same one thing with this one. Push up to the side. Okay, lift it up. Okay, sorry. Okay, so now we're gonna stand up. Get back on the screen. Okay. So close your eyes for me. Do you feel dizzy or anything? Do you feel okay? Okay. So that's testing his part of his cerebellar. Can you heel to toe walk for me? Okay, come back. And then can you stand on one foot? Okay, stand on the other foot. Alright, good. So that was testing cerebellar. It's intact, it's good. Everything looked good. Okay, lift this ankle up for me and roll. Roll the other way. Up, down. Okay, bend your knee. Bring it back. Okay, do the same thing with the other foot. Ankle, roll. Up, down. Bend your knee. Bend it back. Okay, and then we're going to sit down and we're going to test his strength in his feet real quick. So push down on the gas pedal. Okay. Push up. Sorry. And then squeeze my fingers. Okay, so his strength has been 2+ everywhere. Cap refill on his feet are also less than 3 seconds. His feet are kind of cold. I'm going to look at my sheet, do my 1 sheet check. Body structure, behavioral appearance, blood pressure, head is symmetric, lids, lashes, pupil size, red reflex, assess the patency of the nose. Object. I'm looking at the cranial nerves. Okay. So I forgot to use sharpened dull with his face. And I forgot, so his A to P ratio is 1:2, which is what we want to see for his anterior posterior thorax. Close your eyes for me, tell me sharp or dull.
Dull. Sharp. Dull. Sharp.
Okay, so he's able to detect all that appropriately. Can you do this for me? Pat your hands. Okay, put your fingers and then go back. Can you rub this heel on that shin? No, like this, like what I did. Okay, now do it to the other one. Okay, so he was able to do the hand patting, and then the heel to shin. And then close your eyes. Give me sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp.
What's that?
Dull.
Okay.
Sharp.
Okay, and he was able to detect sharp and dull appropriately. So we checked deep tooth and the reflex. We checked all that. Vascular. Your ROM for everything. Oh, I know. Forgot. Close your eyes for me. Okay, and I'm gonna hand you 2 objects. Okay, so put out your hand. What are you holding here? What's it feel like?
Flashlight.
Okay. Now hold your hands out. What are you holding here?
Chest piece.
Okay. Good. I'm going. Keep your eyes closed. Okay, tell me what I'm drawing in your hand.
Triangle.
Okay. And then tell me what I'm drawing in this hand.
Figure 8.
Okay, so he was able to detect those. That's the sternogenesis and graphosynthesis. But he was able to detect both of those. And then I also forgot to note his lips are kind of dry. His gums, I don't remember if I said that his gums were pink and moist with no lesions. Okay, I'm going to look at it one more time and then I think we might be done. So this is my second. Oh shoot, I forgot to do that. Okay, so close your eyes for me. I'm going to test his, put your hands out, his vibrator, if you can tell. Something vibrating?
Yeah.
Okay.
Yep.
Which hand?
Left hand.
Okay, I'm going to check your feet too. Okay, which foot?
Left foot. Right foot.
Okay. Okay. So, Oh yeah, and whenever I lay back down, I can't remember. I'm gonna percuss his belly because I can't remember if I did. Just to do it again and see. And those are. All right, back up for me. And that concludes our physical assessment. Thank you, Justin, and I will wash my hands as I walk out. And thank you.